There are lots of people all around the state worried about the big changes that are coming to the state health plan with higher family premiums, higher deductibles, more out-of-pocket expenses. This is really cost-shifting to more state employees.
And don't forget the change where state employees who are overweight or smokers are going to have to go into a plan that has even higher cost sharing.
There are all sorts of problems with this.
That's right. Well, we thought that we'd take a closer look today at the issues surrounding the state health plan. The first thing we'll do is yesterday, Senate Minority Leader Phil Berger talked a little bit about the secret contract between Blue Cross Blue Shield, who administers the state health plan, and the state. Let's see what he had to say.
I think the contract should be open. I certainly understand the concern about that. You know, the subject of this press conference was transparency, so I think that's one of the things that would be, it would help us get to a solution if we had some openness as far as that contract is concerned, because at this point that becomes a distraction, and whether or not it is the problem or not, I suspect it's not as big a problem as people say, but the fact that you don't know what's there makes it an easy target.
Okay, so we may not be known for agreeing with much of what Phil Berger says.
That's for sure. We really don't agree with him on some things. But this one,
yeah, he's got some good points.
Yeah, he does have some good points. I mean, I think we and everybody else would love to see this kind of secret contract with Blue Cross, and he's also saying that's not the whole story. And boy, do we agree with him on that. I think that the main thing we want to be thinking about here is not just this contract with Blue Cross, but really Blue Cross's actions and the private insurance industry's actions and how those affect the state health plan. Really, this is a question of our whole health insurance system and health reform. Now, luckily, Blue Cross and Blue Shield CEO Bob Gretchen has a little something to say about that in Business North Carolina this past month. Let's take a look at what he had to say.
You could probably solve the problem of the uninsured just by getting the people already eligible for SCHIP, the State Children's Health Insurance Program, and Medicaid enrolled.
Out of the 1.6 million uninsured, how many do you think, if we enroll everyone who's eligible for Medicaid, how many more people do you think that would cover?
Well, I think Bob Gretchen's idea is that sure, we should enroll everybody, but like you say, we're only talking about 200,000 folks here. Even if we enrolled everybody who's eligible out of the 1.5 million people, 1.6 million people we have uninsured in this state. So we go down to 1.3 million people who are uninsured. Not going to solve the problem.
Yeah, that's not quite the answer we're looking for. Yeah, no, but that brings us back to the real problems with the state health plan.
69% of employees on the state health plan are women. 79% of these women cover just themselves, and the average age of state employees on the health plan is 46 years.
So the state health plan costs more because women cost more to insure, older people cost more to insure, and people with pre-existing conditions and chronic illnesses are more expensive. And the state health plan takes everybody who's a state employee and doesn't discriminate against people right now who have pre-existing conditions.
Right. I mean, there's no private health insurer out there who has 70% of their group made up of women. I think the way to really save money in the state health plan would be to make it act more like private insurance. And in this case, that would mean discriminate against women. You would charge them higher premiums, just like Blue Cross Blue Shield does. They charge higher premiums to women who want maternity care, and even if they don't want maternity care, they charge higher premiums to people with pre-existing conditions, discriminate against people who've had a sickness, and discriminate against people who are older, charge higher premiums to people who are older. If the state health plan acted more like private insurance, then boy, I can tell you, we'd be saving a lot of money. I mean, I think we really need to look at seriously making private insurers toe the line on some of these things. And one of our ideas in our health plan reform is to require private insurers to charge the same rate to everybody, regardless of a pre-existing condition. Stop discriminating against people who are sick. We also want them to stop discriminating against women. They should charge the same rate, to women as they do to men. We shouldn't be discriminating in the state health plan and we shouldn't be discriminating in the private insurance market either. That'll solve a lot of our problems.